Thanks, EK, for the nice introduction, and thanks to the organizers for having me here. So I'm in, I think, an even more unenviable position than Tony was, being the last speaker between us and lunch, and also talking about, I think, everybody's favorite subject, economics. How many economists are in the room? I've got one other one. All right, so I was at the UICC's meeting last week in Kuala Lumpur for the first time, and I thought one of the best pieces of advice that I heard was in the plenary that we had on the economics of prevention. And that was that folks in the cancer control community need to hug an economist. So I'm hoping by the end of this session, you'll see why and you'll feel the same way. So over the next 20 minutes or so, I'm going to talk about the work that I've been doing over the last 30 years or so. Briefly touch on the best buys in cancer and other NCD prevention that we've heard a bit about, and then dig a little bit deeper into one of those best buys, which is looking at the impact of taxes in particular on unhealthy behaviors, and then get into some of the issues about why we haven't made the progress that we should have made when it comes to implementing these taxes, raising these taxes, and that's because of the misuse of economic evidence by the industries that produce these products. So when it comes to the best buys, I have to say, Carrie, that I'm embarrassed, frustrated, depressed at times, that my so-called leaders in my country don't implement these in our country, but now are getting in the way of other countries implementing these things. So I spent my life working on developing the evidence base around the impact of interventions to reduce tobacco use, to reduce alcohol use and excessive drinking, to promote physical activity, to promote healthier diets. And as we've heard from many speakers this morning already, we know that these are the key drivers of cancers and other non-communicable diseases. So again, the good news is we do have a huge evidence base. We know what works when it comes to reducing these behaviors and as a result promoting health, reducing cancer. When it comes to the best buys in tobacco use, raising taxes, implementing standardized packaging, large graphic health warning labels, comprehensive bans on advertising and promotion, reducing secondhand exposure to tobacco use, and implementing effective mass media communication plans are very effective and very cost-effective, highly cost-effective. Similar things when it comes to alcohol. Again, we know increasing taxes is going to be highly cost-effective. We know reducing availability, reducing the marketing of these products is also going to have a very effective role in reducing the consequences of alcohol use. When it comes to diet, I think we're still learning a lot about what the most effective interventions are. The best buys that WHO has identified to date are really focused on salt reduction, things like reformulating products, public education efforts to reduce salt consumption. But when it comes to some of the other cost-effective interventions that they identify, tax makes that list as well, talking about sugar-sweetened beverage taxes in particular. So that's what I'm going to focus most of my time on, looking at the evidence on the impact of taxes and prices on these unhealthy behaviors. And I like to start with a quote from Adam Smith. So economics doesn't go back to the 7th century, the 11th century, like we just heard in the previous talk. Modern economic theory really goes back to the 18th century. Starts with The Wealth of Nations, a book by Adam Smith, which provides the foundation for modern economic theory. And in that book, he defined what I've spent my whole life working on. He says, sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption, and which are therefore extremely proper subjects of taxation. So he was talking about this in the context of generating revenues. But the reason that we're all here to talk about these is because they're very, very, very effective tools for promoting public health, reducing cancer and other diseases. When it comes to tobacco, we've got hundreds of studies from countries at all different income levels, all parts of the world, that clearly show when you raise taxes and prices, tobacco use goes down. When taxes and prices are allowed to be eroded over time by inflation or income growth, you see tobacco use go up. In high-income countries, we estimate for every 10% increase in price, you get about a 4% reduction in consumption, and you get a somewhat bigger effect in low and middle-income countries. About half the impact comes because people reduce or stop using tobacco products. We see that in Brazil, for example, the government used tax increases as a way of driving down tobacco use and significantly reduced not just overall cigarette consumption, but the prevalence of smoking. And again, that comes because smokers try to quit smoking in response to higher taxes and prices. So these are some data from the US. looking at smokers' calls to cessation quit lines across the country. And what we see is that there's a huge increase in calls when taxes are going up. The big spike at the right-hand side of the graph is looking at what happened in response to our last national tax increase. And you can see even before the tax goes into effect, smokers are trying to quit smoking in response. And then the other thing that we've learned is that these are very effective at turning off the tap that Princess Dina talked about earlier. Highly effective in keeping young people from taking up tobacco use. So I've been doing a lot of work on this, and what we find is that kids are about 2 to 3 times more responsive to price when it comes to increases in taxes, increases in prices for tobacco products. And then ultimately all this translates into real health benefits. This is a picture from France. France in the 1990s decided to take on tobacco use, started raising tobacco taxes. You could see prices start to go up on the blue line. And as soon as that happens, you start to see consumption coming down, cigarette consumption coming down on the red line. And within a couple of years, you can start to see the improvements in health, in this case, reductions in lung cancer death rates among young males. Unfortunately, France abandoned that policy. You can see that at the end of the graph. Prices stop going up, consumption stops coming down, you start to see the flattening out of those health benefits. So all this evidence is why in the recent NCI WHO monograph that we put out a couple of years ago, we came to this conclusion that significantly increasing the tax and price of tobacco products is the single most effective policy for reducing tobacco use. The other thing is that these are also taxes that can generate a lot of revenues. This is a picture from South Africa. The South African government has steadily increased taxes over time. And as they've increased those taxes, the revenues that are generated from those taxes have consistently gone up. And then some of the work that we've done in the US shows that when you take those revenues and reinvest them in tobacco control programs, you get even bigger reductions in tobacco use. So this picture illustrates that for kids, but we've also seen the same thing for adults, for overall cigarette consumption. And that starts to translate into reductions in healthcare spending, into reductions in things like cancers and cardiovascular diseases caused by tobacco. And again, I think it's this evidence that really led to the Addis Ababa Action Agenda highlighting the importance of tobacco taxes, not just as a way of achieving health goals, but also as a way of providing revenues for other development activities. Now, when it comes to alcohol, we have almost the same level of information. We have dozens of studies, mostly from high-income countries at this point, that consistently show that when taxes and prices go up, you see reductions in drinking. The estimates suggest that a 10% increase in price would reduce consumption by between about 5 and 8% in high-income countries, and about 6.5% in low and middle-income countries. We know that these taxes are very effective in reducing every aspect of drinking, not just drinking prevalence, but also the intensity of drinking, the frequency of drinking. And again, like what we saw with tobacco, we generally see bigger effects when it comes to the impact on drinking among young people. So again, this is illustrated for overall consumption by this picture from Ukraine. Ukraine had allowed taxes and prices to be eroded over time by inflation. And when prices were falling in real terms, we saw increases in drinking. But then a few years back, the government started to raise taxes, prices went up, and we saw the reductions in drinking that followed. In the US, we've seen the same thing. This is some work that we did looking across states at binge drinking rates, so events where people drink at least 5 drinks on a single occasion. And what we saw was the prevalence of binge drinking was directly related to tax rates. States that had high taxes had less binge drinking. States that had low taxes had more binge drinking. And then being economists, we looked at pretty much every other outcome you could possibly imagine that was related to alcohol use. One of the most studied is drinking and driving. We've seen significant evidence showing that higher taxes, higher prices reduce the prevalence of drinking and driving, the likelihood of getting in traffic crashes, traffic fatalities, and again, with bigger effects among young people. We've seen that any health consequences you can think of related to drinking, things like liver cirrhosis, cancer-related or alcohol-related cancers, cardiovascular diseases, and other consequences are also inversely related to taxes and prices. We've seen the same for violence. We've had studies that show that suicide rates, homicide rates, child abuse, spousal abuse go down in response to higher taxes, higher prices for alcoholic beverages. And that other things like workplace accidents, teenage pregnancy, sexually transmitted disease rates are also, again, inversely related to taxes and prices. And like tobacco, this is also a very effective source of revenue. This picture is from the US, where I come from. Unfortunately, in the US, we don't increase our alcohol taxes very often. We've had one increase in the beer and wine taxes since 1954. But you can see when that one increase happened, we saw a significant increase in revenues, but then it's been allowed to erode by inflation over time since then. So the evidence that we have on taxes and prices for tobacco and alcohol have led economists like me to start thinking about how we might be using price policies to influence diets and ultimately to impact on obesity. So there's a lot of economic research that looks at the impact of prices on consumption of different foods and beverages. We consistently see, again, that there's strong evidence that price drives people's consumption decisions. One review that we did a few years ago, for example, concluded that if you raise the price of sugary drinks by 10%, you'd get about a 12% reduction in consumption. We also saw the price was very important when it came to things like fresh fruit and vegetable consumption, fast food consumption, other healthy and unhealthy products. When we start to look around the world, we see a few basic facts that I think have driven some of the interest in sugary drink taxes in particular. One is that there's a clear relationship, and this is supported by a number of meta-analyses at this point, between sugary drink consumption and obesity rates. Countries like the US and Mexico that consume a lot have the highest obesity rates. Countries that consume less have lower obesity rates. And then the other thing that's been happening is that the affordability of these products has been increasing very rapidly across countries. So what I'm doing here is just looking at how prices have changed relative to incomes for soft drinks across countries over the world between 2000 and 2013. And what we see is that in virtually every country around the world, the one exception is Japan, that these products have become much more affordable over time. And it's that increase in affordability that really contributes to increases in consumption of these products. So as the products have become cheaper, what we've seen is that consumption has gone up. And in the few places where they might have become a bit more expensive, we've seen consumption go down. So again, this has motivated at least some governments to start to think about taxing some of these products. Mexico is the first that's adopted a significant tax on sugary drinks. In 2014, they implemented a tax of 1 peso per liter, which raised prices by about 10% on sugary drinks, a little bit of variation depending on the product, depending on the part of the country. And again, this tax was very effective in generating revenues, almost 16 billion pesos in new revenues in that first year. And at the same time as they did that, they also implemented a junk food tax. So contrary to some people's opinions, we do have evidence on the impacts of these taxes. A lot of work going on evaluating what's happened in Mexico. We know that the tax has significantly reduced consumption relative to what it would have been otherwise. And we've seen that effect growing over time. At the same time, we've seen people substituting away from the taxed beverages to untaxed beverages, things like bottled water, in response. So again, changing the mix of healthy and unhealthy products that they're consuming. We know that these taxes have their biggest impact in some of the most vulnerable populations. These are some data showing the impact on purchases by households at different income levels, and we've seen the biggest reductions in purchases in the lowest income populations, very similar to what we've seen for tobacco and for alcohol. And then the bottom line here is that they're also having an impact on the people that are the heaviest consumers of these products. So the populations that consume the most cut back their consumption most in response to the higher taxes and higher prices. So you would think with all this evidence, we might be making a lot of progress when it comes to implementing these taxes, but unfortunately that's not the case. We have made some pretty good progress, I think, in the tobacco world. We've seen a lot of governments adopt and implement significant increases on taxes, but most governments still fall short of the targets that WHO sets of 75% of retail price being accounted for by tax. Hong Kong's made a lot of progress on this, but Hong Kong still falls short of meeting that WHO targets. We've made almost no progress with alcohol taxes. Alcohol taxes on average around the world account for about 17% of price, so very, very, very low. And what we see in a lot of countries is that they don't even tax all the alcoholic beverages that are sold in their countries. So again, this is a picture looking at countries based on which products they tax and which products they don't tax. And I have to say I was a bit surprised when I started looking at this for Hong Kong to find out that you tax high alcohol content beverages, but you don't tax low alcohol things like beer and wine. So there's a lot of room for progress here as well. And then the sugary drink taxes are something that's really just starting to emerge, but is really starting to take off. Mostly in smaller countries, but we have seen some significant taxes implemented recently in places like the UK and South Africa, as well as a number of cities in the US. So again, I know there's some interest in these taxes here in Hong Kong, so this would be a good opportunity, I think, as well. So anyhow, why haven't we made this progress? I think it comes back to one of the things that we heard a little bit about this morning, and that's that there are huge multinational companies that produce these products and that are very effective, very connected with ministries of finance in particular, and making arguments about all the bad economic things that are going to happen if you implement these taxes. And the beverage companies have learned very well from the tobacco companies and have co-opted some of these arguments in recent years. The big three arguments that they make are that if you do this, you're going to cause massive job losses in your countries as people respond by cutting consumption. This is an argument that gets used against all control policies, not just taxes. A second argument that they make is that these are regressive taxes, that if you raise these taxes, they're going to hit the poor the hardest. And then the last argument is that if you raise taxes, this is going to automatically lead to a lot of smuggling, people avoiding the taxes, tax evasion in response. So in the last couple of minutes, just some very quick responses to these arguments. Great evidence on this from tobacco, and we're developing the evidence for alcohol and sugary drinks. When it comes to the excise tax and job stories, the industry is telling you part of the story. They're telling you about what would happen to the sector that they work in and arguing that their economic contributions are much bigger than they actually are, and that if you reduce employment in that sector, that leads then to multiplier effects through the rest of the economy and significant job losses. What they don't tell you is the other half of the story. If people don't consume these products, they still spend the money that they were spending before on those products, but now they buy other goods and services, and when they do that, that creates jobs in other sectors. The government gets tax revenues from these products. They're going to spend those tax revenues and typically on much more labor-intensive activities than production of these products. And what we've seen from dozens of studies now for tobacco and from some recent studies that we've done for sugary drinks and for alcohol, you tend to actually see increases in employment, net increases in employment in response to the implementation of these taxes, not reductions. When it comes to the regressivity arguments, it is true that excise taxes, consumption taxes are generally going to be regressive taxes. But the bottom line is that these taxes can be very progressive from a health perspective. What we know is that low-income consumers are the ones that respond the most to the taxes. They cut their consumption the most. And as a result, the health benefits that result are really going to fall disproportionately in the lowest income populations. That's illustrated by this picture from Turkey. What we're doing here is just looking at how taxes affect consumption across different income groups in Turkey. And what you can see is the big reductions in consumption in the lowest income population, so much so that they actually reduce their tax burden, and smaller reductions in the higher income populations that end up paying the disproportionate part of the tax. The second part of the story is it really depends on what happens with the revenues that are generated from these taxes. Again, these taxes generate considerable revenues, and when those revenues get put back into programs that specifically target low-income populations, you get real progressive effects there as well. So I think the Philippines is probably one of the best examples of this in the world recently. In 2012, the Philippines implemented what they called a sin tax reform, big increases in tobacco taxes, some increases in alcohol taxes. And what they did was to take 85% of the incremental revenues that they got from the tax and put that back into their universal health care system. And in particular, put a pot of money aside for low-income Filipino households. So you can see that the Ministry of Health's budget tripled as a result of the increase in the tax. And we've seen significant increases in the money that's been allocated to low-income households. And then that last argument on illicit trade, if you just look at what's happening around the world, the picture is exactly the opposite of what it would be if it was taxes that were driving illicit trade. Countries that have the highest taxes and prices have some of the lowest levels of illicit trade, and vice versa. Countries with low taxes, low prices have some of the highest levels. And what it really comes down to is strength of governance. It's a matter of how effectively tax administration works, how aggressively these policies are being implemented, how corrupt the government is. So again, we've done some work showing that it's really that drives the illicit trade. It's not the tax and price levels that are driving it. And then the last point is that if governments want to do something about this, they can do it. We have good case studies from a number of countries around the world. This is from the UK in particular. The UK, if you go back to the early 2000s, had a real problem with illicit trade. About 28% of cigarettes consumed there were avoiding or evading taxes. But what they decided to do was to make this a priority, to adopt some of the new technologies that are available, to enforce their tax laws better, to engage in a variety of different multilateral, multi-sectoral efforts. And what they've been able to do is drive down illicit trade to less than 10% of consumption at the same time as they've been able to raise their taxes and generate more revenues from those taxes and reduce tobacco use overall. So again, just in conclusion, we know that higher taxes on alcohol and tobacco and sugary drinks taxes are going to be very effective in reducing consumption. And as a result, that's going to lead to reductions in cancer. It's going to lead to reductions in other non-communicable diseases that are caused by these behaviors. And when it comes to those economic counterarguments that the industry uses, they're either completely false or they're going to be greatly exaggerated when you look at what's actually happening. And that's why taxes are generally going to be considered one of the best buys in NCD prevention. So thank you, and I'm available for hugs.